Hey, I just want to thank Dr. Devos and Danny Bosa for requesting that I produce a video on some thyroid health optimization. So tonight, I'm going to talk about vitamin D and its implications in thyroid health.
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Patients often ask me, what can I do to optimize my thyroid hormone optimization? Well, besides the obvious, which is, optimizing their thyroid hormone medications, there's some obvious outliers that we tend to overlook, albeit even though they're obvious. Some things include ferritin, selenium, and vitamin D. Aha! The third one, vitamin D, is what I'm going to talk about tonight. So let's start from the top. You go out, you get exposed to ultraviolet B, not A, B radiation, UVB, and it converts 7-dehydrocholesterol to pre-vitamin D3 in the skin, okay? This is then converted to cholecalciferol. In the liver, cholecalciferol is then converted to 25-hydroxy vitamin D3. This is considered the major circulating form of vitamin D in the body, but it has very minimal biologic activity whatsoever. Now, 25-hydroxy vitamin D3 undergoes secondary conversion in the kidneys to 1,2,5-dihydroxy vitamin D3. 1,2,5-dihydroxy vitamin D3 is considered the body's major biologically active form of vitamin D3. So this brings us to the question, why is vitamin D3 and thyroid hormone health actually related to one another? So vitamin D and thyroid hormone receptors actually have very similar molecular structure to one another. Vitamin D status and certain vitamin D gene polymorphisms, believe it or not, have actually been implicated in autoimmune thyroiditis. Autoimmune thyroiditis is actually known as Hashimoto'S disease. These are characterized by the presence of antimicrosomal antibodies or thyroid peroxidase antibodies. Those are the two of the major lab values that we draw when you're trying to diagnose someone with Hashimoto's disease. Believe it or not, Hashimoto's disease is actually one of the major causes, upwards of roughly 60 to 80% of hypothyroidism out there. Hashimoto's disease is one of the major causes of hypothyroidism. So vitamin D status of 30 nanograms per ml or less, which is considered deficient, is actually implicated in patients developing Hashimoto's disease at some point in their life. Much of the literature supports that the reasoning behind this relationship between vitamin D and Hashimoto's disease is based on vitamin D's ability to be expressed in your immunomodulatory cells, namely T cells, B cells, and dendritic cells. However, when vitamin D is in a negative load, or in other words, you're vitamin D deficient, these T cells, B cells, and dendritic cells leads to a shift from your Th1 status to Th2 status. Th1 to Th2 status shift has been implicated in the development of autoimmune diseases. Furthermore, Th2 phenotype has actually been implicated in people developing inflammatory cytokines that actually attack your own body, aka an autoimmune disease. In this case, we're staying within the scope of talking about Hashimoto's disease. So someone with vitamin D status in the negative has actually been reported to have higher incidence and prevalence of developing a Th2 status phenotype, which promotes pro-inflammatory cytokines that actually attacks your thyroid gland. Furthermore, the degree of vitamin D deficiency has also been implicated in the actual load of antimicrosomal antibodies and or thyroid peroxidase antibodies. In other words, if you have low vitamin D status, you have a greater propensity towards developing Hashimoto's disease, which is autoimmune thyroiditis, and you also have a greater propensity towards having a higher antibody load towards your thyroid status or towards your thyroid gland. So let's do a quick recap, okay? 1. In patients with hypothyroidism, lower vitamin D statuses are associated with a higher incidence of Hashimoto's disease. Once again, that's in patients who are already hypothyroid. In patients who have hypothyroidism and low vitamin D status, the incidence of more hypothyroid symptoms and worsening prognosis of the disease are highly correlated with vitamin D levels. 2, vitamin D works as an immunomodulator. In other words, higher vitamin D statuses promote less anti-thyroid antibodies and less progression of the autoimmune disease process itself. And lastly, number 3, vitamin D statuses are associated with better treatment of hypothyroidism and improved resolution of symptoms in patients who are already on thyroid hormone replacement. When managing hyperthyroidism, it's important to manage vitamin D appropriately as it leads to better outcomes. Personally, I recommend obtaining a vitamin D status of at least 60 to 80. However, anecdotally, I see patients doing great, roughly 80-ish. Anyways, I just want to appreciate or tell y'all thank you for listening to this.
If you appreciate the content we bring to this channel, check out the Amazon links in the description of this video. These are the links to the products we use, going from supplements, protein powder, pre, post, intra-workout, anti-aging cream, sunscreen, needles and syringes to inject, and so on. If you'd like to purchase one of those products, please use the direct link so that it will earn us a few cents as a tip, and you'll be guided directly to the products we recommend. Thanks in advance.
All links should work on the US, Canadian and UK Amazon stores.